Hi friends, my name is Dr. Dinesh Reddy. I'm working as Director for LMR Hospital. My background is I'm a physician, did my diploma in family medicine, community mental health, and I am also certified central government industrial health specialist. My expertise in diabetes care, chronobiology, occupational medicine, and AI in healthcare. I'm also working as editor for IMAMS board, member of board of studies for IMS CGP. These are my credentials. So coming to my topic, uh, a study on poor sleep hygiene and obesity among different groups of workers in the petroleum industry in Andhra Pradesh. The study was done by me because I'm already working as a occupational health doctor since last 10 years. So coming to what are the important points? First is introduction. Next is review of literature. Third is aims and objectives, methodology, results, discussion, limitations, conclusion, recommendations, references, and annexures. So coming to the introduction. So in recent years, the correlation between occupational health hazards and chronic health conditions such as obesity has garnered significant attention within the public health disclosure. So this study focuses on the petroleum industry in Andhra Pradesh, a sector characterized by demanding work schedules and significant exposure to occupational stressors that potentially disrupt sleep patterns and contribute to obesity. So what do the global trends say? Global trends indicate that occupational environment can significantly influence physical health outcomes. So in industrial settings, factors such as shift work, long hours, stressful work conditions have been directly linked to poor sleep hygiene, which in turn affects metabolic health. This relationship is critical to understand because metabolic health issues such as obesity significantly increase the risk of chronic diseases, including diabetes, heart disease, and hypertension. This thesis explores these dynamics within the context of petroleum industry, aiming to provide empirical data and insights that can inform targeted interventions. So, by investigating the specific impacts of occupational factors on sleep and obesity, the study contributes to a nuanced understanding of how workplace environment should be structured to promote health and well-being among workers. So, coming to the chapter 2, we have so much literature, means the review of literature. Overview of sleep hygiene and obesity was discussed in Knudsen 2000, Patel et al. 2009. So recent systematic reviews highlight a robust link between sleep hygiene and various health outcomes, with poor sleep hygiene identified as a significant risk factor for obesity. What do these studies suggest? They suggest that inadequate sleep characterized by short duration and poor quality disrupts hormonal balances which regulate appetite and metabolism, leading to increased risk of obesity. So what is the occupational impact on sleep and health? So relationship between occupational factors and sleep has been extensively documented across various sectors. Shift work, particularly common industries like petroleum, healthcare, and logistics, has been associated with disruptions in circadian rhythms, leading to poor sleep hygiene. This was in Ackersted et al. 2003. And there was also a seminal study by Smith et al. In 2019 on logistic workers illustrated how irregular shift patterns exacerbated weight gain by disrupting normal sleep cycles. Coming to comparative analysis across industries, comparing sleep health related health outcomes in different industrial contexts reveal significant variations. For instance, office workers typically experience better sleep hygiene than shift workers in manufacturing or petroleum sectors. This was also a study done by Johnson and Lee in 2020. These differences underscore the need for industry specific health interventions. So coming to theoretical frameworks, theoretical models such as circadian rhythm theory and sleep debt hypothesis provide frameworks for understanding the impacts of disrupted sleep on human health. The circadian rhythm theory explains how misalignment between external work schedules and internal biological clocks leads to metabolic dysregulations, while the sleep data hypothesis suggests cumulative effects of sleep loss result in long-term health deficits, which was also given in Spiegel et al. 2005. Coming to intervention studies. Research on interventions aimed at improving sleep hygiene in occupational settings shows promising outcomes. In Patel et al. 2021, conducted a randomized control trial in an industrial setting, finding that interventions such as tailored sleep education and scheduled adjustments significantly reduced BMI and improved metabolic health markers among participants. Critique of current literature. While existing studies provide valuable insights, they often neglect the socio-economic variables that may influence sleep hygiene and obesity outcomes. Furthermore, much of the research relies on self-reported data which can introduce bias. So there is a clear need for more objective measurements methods in future studies to enhance data reliability. So coming to our aims and objectives, the main aims were three: to examine the prevalence of obesity. So likely aim to measure the rate of obesity among these workers, how widespread the issue is within the specific demographic. Secondly, explore the relationship between sleep and obesity. Another key objective might be to explore the correlation or causation between poor sleep hygiene and obesity among workers. To identify variations among different worker groups, as we have taken two worker groups. One is like uh, shift workers that are tank drivers. Another one is office workers. So coming to our methodology, we had a study design, which is a cross-sectional comparative study design to explore the relationship between the sleep hygiene and obesity among different groups of workers in the industry located in AP. Though this design is chosen for its efficiency in collecting data from a large number of subjects at a single point in time, allowing for the analysis of prevalence and correlation between various factors without manipulating the study environment. So we took informed consent. Verbal consent was taken from all the workers and all the BPCL Bharat Petroleum management, which has given me so many permissions for doing this study. So privacy was maintained during this questionnaire. Ethical practices were followed, like proper approvals and permissions from the plant authorities were taken to conduct the study, and each and every step has been taken to establish good ethical practices. So coming to participant selection, the study targets two primary groups within the industry. One is tank drivers, who are like shift workers, and office workers who are like go on a regular shift. So they don't move from time to time. So coming to inclusion criteria, employed full time within the selected petroleum industry, age is between 20 to 60, who are not currently on medical leave or undergoing treatment for sleep disorders or major metabolic diseases. So we excluded the people who are on medical leaves. We excluded the people with sleep disorders and metabolic diseases. Exclusion criteria include female population due to extremely tiny size. So coming to our sampling strategy, a stratified random sampling technique is utilized to ensure the sample is representative of broader workforce within the petroleum industry. So as we take each stratum, tank drivers and office workers is proportionally represented according to the total workforce composition. So a total sample size of 283 workers, in that 193 tank drivers and 90 office workers was determined using an online sample size calculator with a 95% confidence level and a 5% margin of error, assuming a population proportion of 50%. So out of 385 tank drivers, 193 sample size, and out of 122 tank drivers, 90 sample size were taken after the calculations. So what were the data collection methods? It is very simple. We use self-report questionnaires. So they are designed to gather data on demographic information, sleep hygiene, like in how much time they are sleeping, duration, disturbances, is the sleep regular or not, self-reported weight and height for BMI calculations. To complement the self-reported data, BMI was also verified from previous health records of the periodic medical exam. So we do a periodic medical examination for these workers on 6 months basis. So we took some time and also cross-verified the previous health records to make the data more reliable. So coming to the statistical analysis, data analysis was conducted using Microsoft Excel, Open EPA software. Descriptive statistics like mean, median, mode, and standard deviation were calculated for all measured variables. Inferential statistics are used to determine the relationships and differences between the groups. We also deployed independent t-tests for continuous variables like age and BMI and man-Whitney U-test for variables like sleep duration due to different distribution of the sleep. As the sleep distribution is not even, so we used the man-Whitney U-test. So these are the dates we did the research activities. Like first we collected the demography, so we took the questionnaire, data collection. Again, then we analyzed it, we did the statistical calculations, we draw the conclusions, and finally we prepared diagrams, tables, printing of the project was done. So in these following tables, I will be showing some statistics. So these are the descriptive statistics for tank drivers. You can see the mean, median, mode, age, BMI, average sleep hour duration, total population. You can see the descriptive statistics here. In the table 2, these are the descriptive statistics for office workers, like age, BMI, duration, and population. Then comes to determine if there is a statistically significant difference between these two groups. We can use the test as I mentioned earlier. So let's start with the age and BMI, which are continuous variables. Age and BMI are continuous variables. So we used a two sample t-test assuming unequal variances since the sample sizes are different. You know the null hypothesis and alternative hypothesis. So we found a significant difference. So we also, in BMI, we also used a two sample t-test assuming unequal variances, null hypothesis, alternative hypothesis, and unpaired t-test for each variable of interest for both tank drivers. So we found in the age and BMI, definitely we found the p-value was very less, less than 0.001, and in the BMI 0. So we found the statistical significance regarding these two groups. This one is a figure showing the heat map of age and BMI for tank drivers and office workers. So for sleep duration, which is a continuous variable but different distribution of sleep, we used the man-Whitney. So since the distribution of sleep might not be normal and sample sizes are different, the man-Whitney U-test resulted in U statistic of 4.1115 and a p-value of approximately 8.03. Still, it was statistically significant. So p-value was statistical significance there as the p-value was very less than 0.04. Coming to the results, the independent t-test analysis revealed significant differences between the tank drivers and office workers in terms of age, body mass index. The average age of tank drivers was significantly higher than that of the office workers. This indicates a substantial difference in the age demographic between two groups, with the tank drivers being older on an average. This is a figure 2 age visualizations showing the box plot of ages, tank drivers, office workers, and a grouped bar chart of the ages. Coming to the BMI, the results also indicated a significant difference in BMI between drivers and office workers. The values were very significant. This suggests that tank drivers have higher BMI compared to the office workers. These are also some figures showing mean BMI with the standard deviation, dot plot of mean BMI. So coming to this table, we took an independent t-test comparison between tank drivers and office workers. So you can see the age and BMI, they see the p-values. Both age and BMI were extremely statistically significant because the p-value was very less. So each row represents the mean and standard deviation of the respective variable for each group with t statistic and p-value indicating the level of the significance. So the terms extremely and highly indicate the strength of the significance based on the p-value. What is this figure? Figure 4 is like annotations plot. These are with sample sizes with annotations, statistical annotations plot. Coming to sleep duration, this is the figure. Man-Whitney statistics gave a very low value. So difference is unlikely to have occurred by chance because suggesting that the two groups indeed have a different sleep patterns. This is Man-Whitney U-test figure, sample sizes with Man-Whitney U-test results. Coming to the discussion, so observed differences in age, BMI and sleep duration between the tank drivers and office workers highlights potential disparities in health outcomes associated with occupation. The significantly older age of the tank drivers may reflect the longer tenure in their profession, which could contribute to higher BMI due to age-related metabolic changes and prolonged exposure to occupational hazards. The higher BMI observed among tank drivers compared to office workers may be attributed to various factors, including sedentary behavior during long hours of driving, irregular eating patterns, poor sleep hygiene. The shorter sleep duration reported by tank drivers may be indicative of disrupted sleep patterns associated with shift work and irregular working hours, which can disrupt circadian rhythms and contribute to weight gain. So, as you know, in the many studies, as circadian rhythms disrupt, it always leads to a metabolic hazard. Coming to our limitations, so it is a cross-sectional design, and as you know, we excluded the female population. This type of study design restricts the ability to infer causality from observed effects. It only provides a snapshot in time without showing how relationship between variables develop or change. As you know, our data is self-reported. Still, we maintained the cross-checking by going back to the records to decrease the bias. Single industry and gender focus, the LPG, this industry is like a study sample was done exclusively from the male population. So this limits the generalizability of the findings to other populations, industries and settings. So we have to do on a broader occupational context. So we have to do further studies. Coming to the conclusion, this thesis has eliminated the intricate relationship between occupational uh, factors and sleep hygiene and health outcomes, particularly obesity among workers in the petroleum industry. And the findings highlight a significant association between poor sleep hygiene characterized by irregular sleep patterns, shorter sleep durations, disruptions caused by shift work, elevated BMI levels, especially in tank drivers compared to office workers. So the disparities in sleep quality and obesity observed among petroleum industry workers can be attributed to several occupational stressors. These include long and unpredictable work hours, night shifts, and the physically demand nature of the tank driving. Such factors disrupt circadian rhythms, leading to poor metabolic health, which can in turn exacerbate weight gain related. This disruption is particularly pronounced among tank drivers who face unique challenges such as extended periods of sedentary behavior. So they have to sit tight for long periods, exposure to varying environmental conditions, physical strain of operating heavy vehicles. The study's reliance on self-reported data from a male-only sample within a specific context does introduce certain limitations. So self-reported data can be subjected to bias such as inaccurate recall or social desirability bias. So furthermore, the male-only sample restricts the generalizability, and including female workers who may experience different occupational stressors and health outcomes. Future research should aim to include a more diverse sample to capture a wider range of experience and ensure the applicability of findings across different demographics and industries. So despite these limitations, this research provides a crucial foundation for the understanding how occupational health interventions can be tailored to specific industrial environments to improve worker health outcomes. The evidence underscores the need for targeted interventions that address the unique challenges faced by different occupational groups within the industry. So, for instance, implementing shift work policies that minimize disruptions to circadian rhythms, providing access to resources that promote healthy sleep hygiene, designing ergonomic interventions to reduce physical strain. So, we can design the tank driver's seat which can reduce the ergonomic hazard like that. which could significantly improve health outcomes among the workers. So, in conclusion, this research contributes to a growing body of evidence that emphasizes the critical role of occupational factors in shaping the health outcomes. So, by addressing the specific needs of workers in the industry, targeted interventions can be developed to mitigate the negative health impacts of poor sleep hygiene and occupational stresses. Ultimately, improving the health and well-being of workers not only enhances their quality of life, but also contributes to greater productivity and efficiency within the industry. So it will be helpful for the productivity and efficiency of the industry also. So the future research should continue to explore these dynamics across diverse populations and industries to develop comprehensive strategies for promoting occupational health and well-being. So, what would be the recommendations from this study? So, first one is sleep hygiene education and training. So, we have to develop comprehensive educational programs that are integrated into regular training sessions for new and existing employees. So, these programs should cover basics of sleep science, health impacts of poor sleep, practical tips of enhancing sleep hygiene, such as consistent sleep schedules, creating a restful sleeping environment, managing work-related stress. Secondly, what will be the recommendation? Policy reforms and shift scheduling. So reforms shift scheduling practices to minimize disruption to workers' natural sleep cycles, implement schedules that rotate clockwise, morning, evening, night, to allow gradual adjustment of the body to the biological clocks. Consider limiting the number of night shifts any worker can undertake consequently and ensure adequate days off between the shift changes. Another is workplace sleep zones. So establish designated workplace sleep zones equipped with nap pods or rest areas where workers can take a short restorative naps during the breaks, especially in continuous operation settings. Research indicates that even brief naps can significantly improve alertness and performance because tank driving is a highly demands high alertness and performance. Mental health and stress management programs in stress and mental health issues can exacerbate sleep problems, obesity, provide access to mental health support, stress management workshops. These should focus on techniques such as mindfulness, meditation, cognitive behavioral strategies to manage work related stress. Diet and physical activity. Offer programs that promote physical activity and provide nutritional guidance tailored to shift workers' needs. Facilities such as on site gyms or organized fitness classes and healthy eating options in cafeterias can support physical health and complement interventions aimed at improving sleep. Another one is longitudinal health tracking and research. So we have to initiate health monitoring programs to track changes in employee health. This would allow for the evaluation of intervention effectiveness, provide data-driven insights into the health trends within the workforce. Partnerships with healthier work environments. Collaborate with local health departments, universities, other industries to share best practices and research findings related to occupational health. So these partnerships can enhance resource sharing, increase the breadth of knowledge, innovate new solutions to common problems like obesity and poor sleep hygiene. So this is the annexure one, means what is your age, gender. This is a self-report questionnaire we used in the study. It is a very simple seven question questionnaire. And these are the Excel sheet we use it for calculating the mean, median, mode, and other things. It's a snapshot. This is the software we used, OpenAPI, for calculation of the statistical significance. So finally, thank you to all. So best sleep hygiene practices: go to sleep and wake the same time. Meditate for 10 minutes prior to this. Create a bedtime routine. Switch off devices 1 hour prior to the sleep. Avoid large meals close to the bed. Get enough exercise through the day. Make your room dark as much as possible. Keep your room cool. No stimulants after lunch. These are the best sleep hygiene practices. With this, I thank you all for patiently listening my lecture regarding the sleep hygiene and obesity.